Hi Joyce, how are you?
Good, how are you?
Very good. So I see in your chart that this is your first time seeing me. Wonderful. Well, welcome to the office. When's the last time that you had a head-to-toe exam?
Probably about 2 years ago.
Okay, so it's about time. All right. I'm just going to ask you a few questions. Can you verify your date of birth for me?
Sure, it's 4/13/1994.
Okay, that's what we have here. And do you have any family history of hypertension?
Just on my dad's side.
Your dad's side, okay. Lung disorders, blood disorders?
No.
Okay. Diabetes? Okay. Stomach issues?
No.
Okay. Do you yourself have any history of gastritis, abdominal problems?
Not in particular.
Okay. Any recent surgeries in the last 12 months?
No, not in the past year.
Okay, great. Okay. Do you follow any special diets?
No, I tried to do low carb when I can, but not always successful.
Okay, sure, I understand that. And has that been successful for you when you do follow it?
Sometimes.
Sometimes we need that bread, but it's good to try these things, as we get older. Sometimes it's good to just not so much lay off of carbs, but make sure we get enough protein. It's really important for nutrition. So
Great point.
glad to hear that. And do you exercise?
Yeah.
Okay, how many times a week?
4 to 5 days a week.
Wonderful. Okay, and is that aerobic activity? Okay.
Mostly cardio.
Cardio, that's great. Okay. Any major life changes in the last 12 months?
No.
Okay, great. And do you work a job that involves a lot of sitting?
Yes.
Okay. And one last thing, do you have any aches or pains today? Anything that you come in here that...
I've been having a little bit of tingly, numbing sensations between my elbows and my fingers, between my joints.
Okay, is this on both hands?
Yes.
Okay. Does this happen in the feet as well, or just the hands?
Mostly the hands.
Okay.
Occasionally the feet.
Sure. And does this happen at any particular time of day?
Usually after work, after I've had a long day and I'm feeling quite tired.
Okay. Do you do a lot of staring at a screen for work and typing? Okay, definitely could be a work-related, just neurological issue. But I'll check on that and do some sensory tests. On a scale of 1 to 10, what's your pain right now?
Right now, like a 4.
Okay. And when it gets at its worst, what would you describe it as?
I would say a 7.5 to 8.
Okay, and that would be like in the late afternoon when you're finished with your shift. Okay. Are you taking anything currently to help the pain or doing any exercises?
Mostly just yoga, some stretching to help with circulation, and just taking vitamin C, fish oil, my omega-3s in general, help with glucosamine. And
great, that's great. Perfect. All right, well, you seem healthy overall. I'm going to go ahead and grab your vitals. We'll do a head-to-toe exam, and I'll make sure that I pay special attention to your hands.
Sounds great.
Okay.
Thank you.
Sure. I'm going to put on some gloves. Okay. First, I'm going to listen to your heart and your lungs.
Okay.
So make sure that your legs are completely uncrossed. Just breathe normally for me. sounds normal. No congestion in the chest. Both sides of the chest. Okay, I'm going to flip over and listen on the bell side. Okay, can only hear S1 and S2. No S3, no murmurs. Okay. Any heart racing issues? Dizziness when standing?
No.
Good. Is this comfortable for you?
Mm-hmm.
Great. Okay. All right. And just relax for me. Okay. That is 90/72, so that's really good. I can tell that you're a runner. You have a lower blood pressure.
Thank you.
Mm-hmm. Okay. Going to check your oxygenation. Can I see your index finger? Perfect. Just lay it right here. Okay, your heart rate is 70 beats per minute. Oxygenation 96% at room air. Okay. Read your temperature too. Okay. 97.2. Great. Okay, all right, go ahead and face me. Do I have your permission to touch your face? Okay, I'm just going to do some palpations, feeling your lymph nodes. Okay. Pre-regular lymph nodes are non-palpable. Post-regulars. Feel right underneath the jawline here. No palpable lymph nodes. Okay. Go ahead and raise your eyebrows for me as high as you can go. Now raise them. Try to lower them for me. Just judging the musculature of the face. Go ahead and turn your head all the way to your left. And I'm going to prevent you from doing that. Great. The other way. Good. Now try to look up at the ceiling for me. Okay. Now try to touch your chin to your chest. Very strong reactions. Very good. Okay. Okay, I'm going to do some percussions of the face. This is just to judge for edema. Okay, everything feels normal. Okay. I'm going to pull very gently on your ears. Let me know if it's painful for you.
No pain.
Okay, pulling up. Any pain?
No pain.
Okay, and pulling down.
No pain.
Good. All right. I'm just going to have you flip over and face this way so I can listen to your back with my stethoscope. Just going to gently move your hair out of the way. Just going to palpate the paraspinal muscles here. No signs of scoliosis or lordosis. Any pain here when I press?
No.
Okay. Pain here?
No pain.
Okay. Just going to go ahead and listen. Okay, take a deep breath in for me and release. Okay, deep breath in and release. Do you use any smoking or vaping products?
No.
Okay, your lungs sound very clear. Just going to percuss. Okay. Everything feels healthy to me. You can go ahead and flip back around.
Thank you.
Okay, go ahead and open for me. I'm just going to check your mouth. Tonsils look nice. No cavities. Proper moisture. All good signs. Okay. Now I'm going to go ahead and check your vision. Do you wear contacts or glasses?
Mm-hmm.
Okay. How long have you had your current prescription?
About 2 years now.
Okay. And you still see fine?
Mm-hmm.
Great. Okay. So go ahead and follow this light. Ignore my fingers. Perfect. Now let me know when the light enters your field of vision. When it does, say now.
Mm-hmm. Now. 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 Now.
Good. And go ahead and look towards me. Maybe put your focal point right here on my nose. Let me know which fingers appear to be moving, the ones on your left or your right.
My left. My right. Both hands.
Okay.
My left. My left. My right.
Very good. Okay. Okay, I apologize for the bright light, but I want you to go ahead and stare straight ahead. I just want to look at your pupils. And they look around and reactive to light. No scarring, scratching, or jaundice. Go ahead and look up for me. Look down. To your left. To your right. Okay, good. Alright, same thing here. Just stare straight ahead. Okay, look to your left. Your right. Look up. Look down. Straight ahead again. Any dizziness in doing that?
No.
Okay, your eyes look very healthy to me. No issues. I want you, actually your hands are occupied, so I'll go ahead and hold this in front of you. This is a Snellen chart. I want you to go ahead and tell me what this row says to you.
OLCF.
Good. Can you read that backwards?
FCLO.
Good. What about this third to last row beginning with the E?
EPTCO.
Okay, and the last row?
LTFPH.
Can you read it backwards?
HPFTL.
Good. And what color is this to you?
Red.
And what's this?
Green.
Good. Which circle is larger here, number 9 or number 5?
Number 9.
Number 5 or number 2?
Number 5.
Number 2 or number 3?
Number 3.
Very good. Okay. Any problems with your hearing or vision? Or, sorry, any problems with your hearing or ears?
No.
Earaches or pains?
No.
Okay. Go ahead and just let me come in right here. Perfect. Here we go. Your tympanic membrane is a nice pearl gray. No scratching to the membrane. Looks very healthy. No excess wax. I'm gonna go ahead and just look around the outer auricle to make sure there's no fungus buildup here. Okay, so hold still. Perfect. Gonna check the other side. Okay. A little bit of wax buildup here. Just make sure to get that cleaned. Other than that, it looks very healthy. Pearl gray tympanic membrane. Okay, gonna look right along the out corners of the auricle. No infection or redness along your piercing, so it looks like you've been taking good care of that. I'm just going to look behind the ear as well, especially since this is pierced. Looks very healthy. Alright, so I'm going to just test your hearing real quick. Close your eyes. Let me know which ear you hear this rustling sound in, your left or your right.
Left. Right. Right. Both.
Okay. Which sound seems further away? A or B?
B.
A or B?
A.
They're about the same. Let's do it with a tuning fork now. Okay? A or B? A or B?
B.
A or B?
A.
Where is the sound coming from? Above your head or below it?
Above.
Okay.
Above.
One more.
Below.
Good. Okay. I'm going to feel a vibration on your head. Let me know when it stops, okay?
Okay.
All right.
No.
Good.
No.
Good.
No.
Okay, good. And did you hear it and feel it at the same time? All right, great. All right. Your ears seem good to me. So I'm going to do a sensory test to your face just to check for neurological function. Okay, so it's sharp or dull. This is dull. This is sharp. Do you feel the difference? Okay, go ahead and close your eyes. Let me know which one you feel.
Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull.
Beautiful. Okay. Let me see if there's anything else I need to do with you sitting. I think we'll do a smell and taste test. So continuing to test your neurological functions, I'm going to do a smell test. Some of these smells are a little specific, so don't worry about getting them perfect. I just want to make sure you're not mistaking cinnamon for wood chips, anything like that. So just close your eyes. Go ahead and inhale. What does that smell like to you?
Like an incense almost.
Sandalwood. So yes, that would be correct. Just gonna write some of this down. Okay. Next one, go ahead and inhale.
Smells like cotton, maybe.
It's rose.
Oh,
Might have a little issue there. Let me write that down.
maybe.
This next one is kind of a herbally scent to give you a hint.
Interesting. I don't know.
That's okay. It's chamomile. This next two, one's hard, one's easy.
Okay.
Good luck on this one. If you get this one right, I'll give you $1 million.
Smells like lemongrass.
It's bergamot.
Bergamot.
So, but that's okay. I think it's similar to lemongrass. And this next one is very citrusy. Go ahead and inhale.
Orange.
Grapefruit, very similar. I'm pretty happy with that. Okay. Next is a taste test. I have some strips of testing of paper. Okay. Go ahead and open your mouth, close, open. What would that taste like to you?
Bitter.
Very good. That was bitter. Okay, second one, open, close, open. What would that taste like to you?
Neutral.
That was control paper, so it shouldn't have tasted like anything. One last one. Open, close, open. What that tastes like?
Also neutral.
Okay. That was supposed to be cinnamon. So I'm just gonna make a note of that. I'm not too worried. Okay. So I just want to go ahead and take a look at your arms, especially the area that you're having issues with. Let me know if you feel any pain, or is it numb when I press?
No.
Okay.
Maybe right there.
A little painful? Okay. Does the pain get worse or better as I go down the arm?
Better.
Okay, so it's just right here. Very classic of someone who types a lot at their desk. What about the hands? Go ahead and make a fist for me. Spread. Do that 5 times in a row. I saw you straining a little bit. Was that difficult for you?
A little bit.
Okay, let's try the other hand. I'll take this bracelet.
Thank you.
Okay.
This is perfect.
Okay. Is it the same level of pain right here in the center? And as I go toward your wrist, is it less painful?
Less.
Okay. Go ahead and do that fist exercise 5 times quickly. Okay. All right, go ahead and rest. Go ahead and close your eyes. Using this hand here, I'm going to place an object in your hand. I just want to test your ability to, your numbness in your hand and to recognize objects. So go ahead and close it. Describe that object.
Circular.
Good.
It's spherical. It's cold.
Good.
It's hard.
Very good. Okay. Go ahead and grasp this one. Close your eyes. What does that feel like to you?
Like a rectangle. It's like plastic. Feels like it's got bristles of some kind. Quite soft.
Yes. Very good. Okay. And one more. Go ahead and grasp it. What does it feel like to you?
Kind of like a pen. It's very heavy and cold. Cylindrical.
Very good.
It's got some divots on it. Very smooth.
Yes. Very good. They're all right answers. I'm going to take this sensory brush and brush it against your hand. Let me know how many times you feel it, okay? Once, twice, or 3 times it'll be.
Twice. Once. 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 3. Twice. Once. 3 times.
Okay. Okay, we're going to go ahead and do the other hand. Keep your eyes closed for me. Go ahead and grasp this object, squeeze it. Let me know what does that feel like to you?
Feels soft, like some type of fabric.
Okay.
Feels like there's something inside of it, maybe like a scrunchie or hair tie.
Perfect. And what color is it?
Purple.
That's okay. Just testing to see if you're psychic. Okay. Go ahead and grasp. Yes. Grasp this object. What does it feel like to you?
It feels soft and feather-like.
Okay.
It's attached to a cold cylinder, maybe some kind of brush or makeup brush.
Perfect. And one more. This one's a little weird, so you don't have to get it perfect. Go ahead and squeeze. And what does that feel like to you?
It's in the shape of a T. It's kind of oblong, so it starts out kind of wide here and gets narrower.
Perfect.
Wide and flat again. Perhaps some kind of spatula.
Oh, you're good. That's perfect. Okay. So next, before we move on, I just kind of want to gently test your range of strength in your arms and hands. So first, bring both hands up, and just with your fingers, press against my fingers. Good. Okay. Bring your hands all the way up. Okay. Go ahead and try to lift them in the air. I'm not going to let you do that. Try to lower them. Good. Now try to spread them apart. Try to bring them together. Perfect. Can you go a little bit harder on that last one? Hard as you can go. All right, good. Okay. And with this object that you said was cold, this is warm. Go ahead and close your eyes. I'm just going to do a warm or cold test on your arms, okay?
Cold. Warm. Cold. Warm. Cold. Cold. Warm. 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 Cold. Cold. Warm. Cold. 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 Warm. Warm. Cold.
Okay. Okay. So I'm not noticing any glaring neurological issues with your hands, which is a good sign. But we're going to monitor that. I'm going to give you a note that says you don't have to go to work for the next
Thank you.
3 weeks.
Thanks, Doc.
Yeah, and so we're just going to see if things improve. You can, you know, just in the meantime while you're at home, just try not to be doing this on the keyboard, because really I think you pulled something and the tendons might be misaligned.
That makes a lot of sense.
Definitely. So before we wrap up, I am going to go ahead and just take a quick look at the abdomen and feet, okay?
Okay.
All right. Okay, so I'm just going to listen to your abdomen. You've been not having any stomach issues, you said?
No.
Great. Just going to listen.
Regular gurgling.
Yeah. Do you mind if I gently lift your shirt? Okay. Okay. Normal. I'm going to palpate. Let me know if you feel any pain or any discomfort.
No pain.
Okay, good. Okay. What about this side? No pain or discomfort? No. Okay, good. All right. We are going to do a Babinski response test on your feet. Do you mind if I take your socks off? Okay. Okay. Slow reaction. I'm just going to test. Let me know when the vibration stops. I'm going to be placing it on your feet.
Now. Now. Now.
Okay.
Now.
Okay. Right.
Thank you.
Sure. Okay. And real quick, just doing another strengthening test. Try to spread your legs apart. Good. Try to bring them together. Try to lift them in the air. Okay. Can you point your toes? Okay. Try to bring them up towards yourself. Now press. Okay. Excellent. All right. Just end. Just going to inspect the scalp, just because we've had a nasty lice outbreak this spring, and I just want to make sure that I'm thorough. Okay. Okay. So as I draw this pen from the edge of your hairline to the center, do you feel it all the way? Okay. Okay. Don't see any lice or critters. A few white flecks. There's going to be some very light dandruff or reaction or to shampoo that you're using. Does your scalp ever itch?
Occasionally.
Okay. Hmm. Don't see any flex here. You just tap right here along the hairline. Tell me if you feel the tapping once, twice, or 3 times.
3 times. Once. 1. 1. 2, 3.
Good.
1. 1. 1.
Okay. Going to do the same with this tool, once, twice, or 3 times.
Once. 3. 2. 2. 3. 2. 1. 2. 2. 2. 3. 2. 1. 1.
Very good.
1.
Okay. Going to just take your scalp temperature. Okay, just along different areas of the scalp.
Thank you.
Normal. Okay. Okay, Joyce. So we're going to follow the plan that I said. The rest of you is completely healthy, head to toe. You're in amazing shape. Your vitals are all fabulous, way above the metric for most people your age. So whatever you're doing, I would keep that up. Just lay off the typing at the computer for a while. I think that's going to really give your arms a rest. And if that doesn't help, we'll go from there and do some imaging tests. But I don't want to jump into that because with your insurance, it might be really expensive.
Gotcha.
Okay.
Sounds good. Thank you so much.
All right. Bye.